If I ever go in a dentist office, don't let me in their lab, because I'm going to go straight for their lab and I'm going to look at their cases and I'm going to see what they're doing. And it's generally, there's a big discrepancy between what they're talking about and what they're doing. There's also a big discrepancy between the education that a dentist will do and what he actually does in his office. And they just take these courses, and you can go back wherever you store your manuals for different courses, go back and look at those manuals from 5 or 10 years ago and see if you're actually using that information. And what you'll find out was you just took the course and you didn't change anything, which doesn't really make a whole lot of difference. A lot of K7s live in the closet, and I don't mean that there are gay K7s out there. I just mean that people don't use their K7s, they just sit around. And very few are proficient at neuromuscular dentistry. Once you kind of get it, you get it. Most dentists are all technical nature, they're not into business at all, and Bob was talking about this sales process. Basically what goes on in dentistry is there's sort of a technical process that goes on here, and it sort of builds on itself. And then there's a relationship, trust, sales process over here. And those two processes need to run parallel with each other. And if one part of your practice is more technical than business or sales, it's just not going to work. So you need to know that there's two separate things going on, and they need to run parallel, or the patient's not going to let you do the dentistry on them. Competence breeds confidence. If you just blew a case and the patient's sitting in your chair and you're going to talk about the same kind of case, you're not going to be able to talk to them with enthusiasm that you need to do to enroll them in the dentistry. So you need to do enough of these cases to become competent, and then it works out for you. I got a call from a dentist not too long ago, and I hadn't talked to him in a while. He says, "Hey Brad, what's going on?" Blah, blah. We talked a little while. He says, "I got a case I want you to help me with." And I go like, "Okay, what's the deal?" He says, "When the patient opens up, it's like their jaw gets stuck, and then they can kind of wiggle around, and then they can open up the rest of the way." And I said, "Well, do they deviate to one side or the other?" "Yeah, they deviate to that side." And I'm going like, okay, this is not that hard. So I go like, "Hey, you still got your K7? And here's the part of the story. He says, "Yeah, I got it." And he says, "I use it on every case." Okay. Well, why don't you run a 13 and a 15 on this patient, and it'll tell you what you need to do. And he says, "That's a great idea." Seriously? I mean, the guy's not using his stuff. And it's just kind of like, it brought the whole thing to fruition for me is, you know, learn the stuff, use it, you'll definitely be way ahead of the ball game. Here's a little bit about my practice. Rod Strickland and myself work in this one practice. We've got 4 rooms. Practice is maybe 2,400 square feet. There's a hygiene room, there's his room, there's my room, and there's a new patient room. And so I work out of one room, he works out of one room. I work 12 days a month, he works 12 days a month. And that's pretty much it. We got a staff of maybe 7 or 8, I think. And they work, we have little teams and all. This year we're going to collect a little over $4 million. And that's nothing but big cases. And it's a real slow pace, and my purpose is, little office, doing a lot of dentistry, you're only going to do that if you really slow the process down, and that's what this whole talk's about. So we intentionally set the office up to do small cases. We don't do kids, we don't do general dentistry, unless it's somebody we did a bunch of dentistry on that needs some stuff. Our service mix is pretty much cosmetics, big cases. Rod does a lot of dentures, facelift dentures. We do a lot of implants. And there's just not a lot of little things going on, just because that's not what we treatment plan. We treatment plan the whole mouth. The practice is values-based, which I'm going to talk about in a minute. It's very relationship-based, which I'm going to talk about in a minute. And for those of you that know me well, I'm not a real relationship-based person. But in the office I am, because that's what makes it work. And then there's a lot of trust-based dentistry going on too. I'm going to talk more about that. But I'm going to talk mostly about trust and values. In order to have a practice like this, there's several different components of the practice that you need to have running parallel to each other. There's kind of a marketing, branding portion. I mean, the patients need to know what you're all about. They need to come in. We have a very refined marketing program. We have a very, I mean, our marketing program is pretty incredible, actually. You need to have a highly trained and motivated team. You need to have a new patient process that works very, very, very well. And then the whole office needs to be involved in selling dentistry, not just one person. Right, Kim? Because that person's going to get burned out or leave or something out. It's a team effort. There needs to be a lot of competence technically. There needs to be a lot of competence by the whole team, and I don't mean stupid confidence. Don't tell the patient you're going to do something you can't do. But today we're only going to focus mostly on the sales process because, we've only just got a little bit of time. So when Bob called me, I was sitting there thinking about what I'm going to do with the rest of my life. And I was thinking, well, everybody talks about building trust with the patients, but nobody really tells you how to do it. And I knew that the values component was already valuable and powerful. And so we basically worked on the values a little bit more, and we worked on building trust, and we made these two little changes, and we track our closure rate. And closing on big cases, we were running in the low 50%, which, if you're doing single tooth dentistry, you ought to be closing 100% of those. But closing big cases, if you get above 50%, that's pretty good. So we went from 50 to 80 when we concentrated on these two little things, and I'm going to share those things with you. But we're going to talk about trust first. Here's the problem with trust violations. The patients will never tell you that they don't trust you, because that's just not, they're uncomfortable doing that. Maybe they might, the super good patient that's high communicative skills might tell you that. But what they're going to say is that it's too expensive, or they can't afford it, or my insurance doesn't cover it, or all the other BS reasons. But it always comes out as cost. So when you hear cost, if you can train yourself to say trust, then that makes a lot more sense. It's a lot better way of doing it. Now, the patients are going to drive up in a $20,000 or $30,000 or $40,000 car. They can put the same amount of dentistry in their mouth. They just have to be able to trust the dentist. So trust is big, but it's just not the normal communication word that they use with you. So here's a quick little test, and here's my 3 pictures of teeth I'm going to show you today. So I'm going to show you 3 pictures, and here's the question I'm going to ask you. I'm going to tell you a little bit about the patient, but just look at these pictures, and if this patient walked into your office, just think to yourself, how would I treat this case, and roughly what would I be charging them, okay? And the answer is pretty obvious to the neuromuscular dentist, because it's just sort of like, because you're going to do them all the same, and the cases all cost the same. But here's, the patient comes in, they want whiter teeth, they're overclosed, they want the facial changes, they got some bite problems, they've got some joint problems, they hate the old PFMs. You've seen these cases hundreds of times walking in your door. You know exactly what they need, which is cute, but if you tell them what they need too early, you're going to violate trust, and you're going to see the back of their head as they walk out the door. So here's the typical case you're going to see walking in. 60-year-old female, overclosed, got some PFMs, the bite's a problem, and you look at that and you immediately go like, well, I'd shoot a bite, I'd put them in a fixed orthotic, I'd leave them in there 3 months, I'd adjust them, I'd do a few other things, get them comfortable, and I'm going to charge them $50,000 or $60,000. Okay, so that's pretty much what everybody's thinking, right? That means yes. Okay, now here's the problem, is that you know that, and this is so intuitive to everybody in the room, but it's not intuitive to the patient. And it's the patient that's receiving the message that you gotta be very cognizant about. So large treatment plans inherently overwhelm the patient. And if you throw too much too fast, which is the terminology, the patients are gonna go like, oh, you're moving too fast for me, or that sticker shock, or whatever all the terms are, it's just not gonna work out. Now, Rod and I were talking about this one day, and he just happened to be reading this article, and this guy in the article was saying that don't present more than $7,000 to a patient, $7,000 for the number of visits that they've been in your office up to the point in time where you present the dentistry to them. Does that make sense? So if it's their first, this is how numerically, for you analytical people, this is how numerically you know you're going to be bumping up against the trust problem. Is if you're presenting more than $7,000 per visit, you're probably going to have a problem. So if this is their first visit, don't talk about a full mouth case. If this is their second visit, that's $14,000, don't talk about a full mouth case. You might not want to talk about the full mouth case until 6, 7, 8 visits down the road, until you've had some success under your belt before you start talking about the total package. Okay, so now you're going like, okay, that's cute. How do I get them in an orthotic, and how do I do this without overwhelming them? And I'm going to show you that in a minute. Is you sort of tell them, but then you don't tell them. Or you tell them and then you take it back. And there's some prime speak stuff in this. But as soon as you quote a fee, the patient is obligated to evaluate their trust in you. And here's kind of what this thing looks like. So I call this kind of the sales balance in dentistry. Is when you quote a fee, all of these factors start flashing through their head. On the negative side, they're going like, is this too much time? Do I have too much fear? Is the cost too much? Is there lack of urgency? Has trust been established? And then on the positive side, they're going like, well, I know this guy's got a good reputation. I know his marketing says this, and all these other positive things, the quality of the experience, the quality of the education, all these other things, and they're balancing this out. But as soon as you make them think on this level, then it's like rolling the dice in the casino. You know, somebody's going to win and somebody's going to lose. So the deal is, don't get to this point too early. So for those of you that like Gary Larson, this is kind of what this is like. Now, the dog cartoon on the left is like patients that make their own decisions. And the dog cartoon on the right are like the cat cartoon are like patients that don't make their own decisions. So first of all, don't talk to somebody that's not the decision maker, because you're just wasting your time. So don't talk to cats. So, but here's what the dog's hear. Okay, the patient comes in, and here's what you're telling them. Okay, patient, here's what I'm going to do. I'm going to take off. I know you don't like your teeth. I know you've got this pain. I know the joints have been there. I know all these other doctors have told you that it's got to be surgery, or it can't be fixed, or it might be your ear, or it might be all these other things. But what I'm going to do is I'm going to take all your teeth out, and I'm going to put this piece of plastic in your mouth, and I'm going to make it better, and then I'm going to change all the teeth around. I'm going to make them whiter, and when we get through, you're not going to have any pain. They're going to look perfect, and you're going to look 15 years younger. Okay, and they're going, what are the patients saying, Fred? Bullshit? Because that's a trust violation. And so you're like, talk. All they hear is, when it says ginger here, all they hear is the cost part. And then they go home, and over the dining room table at night, they go like, hey, honey, what happened today? I went to the dentist. So what did he say? Well, he said something about, that sounds complicated. What did he say it's going to cost? $50,000 or $60,000. Ooh, you need to find another dentist. So that's a trust violation. Now, you've all had that happen, and you've had people beg you to tell you what it's going to cost, and what you just need to say is, I don't know. Because, I mean, you really don't know to the penny. You know pretty closely, but you just don't know, so don't tell them. Here's my second favorite cartoon from Gary Larson. Now, your new patient people, they may sell 3 or 4 cases, and they think that they're just can everybody see this? Can I read it for you? Here's the dog in the car. Ha ha, Biff. Guess what? After we go to the drugstore and the post office, I'm going to the vet's to get tutored. Okay. Well, the dog missed one word. And so if you've got a new patient person that likes to talk too much in the new patient room, too much information is dangerous. And if the patient doesn't understand one word, they get a completely different meaning for what the experience is going to be like. And this happens all the time. You can be derailed and you won't even need to know it. So let's talk about trust a little bit, and here's how to slow the process down. So I mentioned you want to throw some extra visits in there. Now, you only want to throw extra visits in there to the people that you know are kind of like pre-qualified from a value standpoint to get the dentistry done, and I'm going to show you how to do that in a second. But if you throw extra visits in there, then you're way ahead of the ball game. Now, here's how it typically works in our office. Is there's a call, They come in for an initial consult. Now in our office, the initial consult, we don't do records, we just sit down and we talk, okay? We take photos. And then if everybody likes where it goes, they'll follow this left-hand path over here. We'll do an exam on them, then we'll present some treatment to them, that's TPP. We'll work out the financial arrangements. We work out the sequencing is the order I want to do the dentistry in. We'll do the treatment and then we stick them back in recall. So that's our normal process. So in our normal process, we have a consult, an exam, and a treatment plan presentation. If we follow my $7,000 a visit rule, we better not present more than $20,000 worth of dentistry to them. Everybody get that math? Okay. So now let's figure out some other things. Let's say, well, how can we throw some more visits in there? In the second column, a patient that comes in with tooth pain, well, we may do some emergency treatment first. Again, they're pre-qualified. And so now we've got 4 visits in there when we get down to present the treatment. So now we're sort of raising our numbers up a little bit. And you can throw extra visits in there. Sometimes we'll come up with a treatment plan, and in this third column, instead of presenting the whole treatment plan, I may say, look, here's what I'm thinking about doing. I said, but I'm sort of thinking that you might feel more comfortable if we just did a little bit of treatment over here for the side and had some successes with you. Let's just pull this treatment out of the big plan, do this, see how it goes, and then if you like that, then we'll talk about the whole tamale. So I'll intentionally pull a little bit of treatment out, and then I'll do the rest. Now, if you're doing neuromuscular treatment with an orthotic, that's exactly what you're doing. You get them in, you do the neuromuscular exam, you put the orthotic in their mouth, you adjust it a few times, and generally on about the 4th, 5th, 6th, or 7th visit, they're ready to start talking about where the whole thing is headed. But you still have to tell them where it's headed without telling them so much information that it's going to blow them away, and I'm going to show you that in a minute. But you can see on this how you can break up different amounts of treatment and you don't overwhelm them. Does that make sense to everybody? And if you start thinking this way, and the trouble with dentistry is sometimes there's discretionary spending cycles, and they'll be like, everybody's buying dentistry, everybody's buying dentistry, everybody's buying dentistry. The treatment plan coordinator or the new patient person thinks they're like the hottest person on the planet, and then something happens and money tightens up a little bit and people start spending money differently. And you're presenting dentistry over here the same way you were last month, and then all of a sudden nobody's buying any dentistry, and you go like, what the hell just happened? Well, if you throw your $7,000 per visit formula in there, you kind of know when you're out on thin ice and when you're not. And that makes it work a whole lot better. So let's talk about dental values for a minute. The second thing you see up here, values, thoughts, decisions, and actions. Okay, what you see with patients in your office is those are actions that they're making. And the actions are driven by decisions, and their decisions are driven by thoughts. And if you can back it up one step, what you'll find out is that their thoughts are driven by their values. So if you can speak to the patient on this deeper level of values, you can get them thinking about something that's way deeper and way better than one broken tooth. And that's where the whole thing really comes from. I mean, y'all started doing this in y'all's office, Kim. It's made a pretty huge difference, right? Yeah. And it's like night and day. But you got to understand the language. And if the patient comes in with an emergency or broken tooth, treat them like an emergency. You don't have to do permanent dentistry on one tooth, just stick a filling in there. Okay, and we do that a lot. So dental values and primary concerns are different things. If somebody comes in with a broken tooth or this toothache or whatever else, you still have to handle that, but dental values and primary concerns are two totally different things. And values are not their dental IQ. Dental IQ is just how knowledgeable they are about dentistry. Values and dental IQ are two totally different things. Now, generally speaking, higher values comes with higher dental IQs, but they're still not the same thing. And then there's a certain order. Let me back away just a second so you'll understand this. There's a certain order that you need to present information to patients, and if you violate this order that you present the information in, it's not going to work for the patient because there's a certain process that they have to receive the information in order for this work. And you've seen this before. Bill does something similar to this. But the order is need, answer, source, time, cost. Now, need could be their primary concern, but in our office, the need in this context is an unmet dental value. Now, they may not even understand that they have an unmet dental value, but it's the job of the new patient coordinator or dentist to explain that to them. And so what you want to do is stay on need a long time, and this is where the whole values part comes into. Now, answer is your treatment plan. If they have, and this is a primary concern, if they have a broken tooth, that's their need, your answer is a crown, okay? There's 4 values, and one of them is health, okay? But if they have a high health value and they don't have a lot of health in their mouth, then your treatment plan is going to be to make them healthier. This seems simple, but sometimes it can be complicated. Source is the dentist that's going to do it. Time is how many visits it takes, and cost is the number. So unless you go through this thing in this order, need, answer, source, time, before you get to cost, that sales balance thing is going to throw everything off, and there's going to be no sale because it's just not being done right. So the reason I've got this slide up here is to let you know that this is the process and the order that needs to happen. But if it doesn't, and the whole purpose of dental values, which I'm going to tell you more about in a minute, is to help develop a higher level of need. Okay? So if you've got patients walking in your office saying, I've got this toothache, or if I've got this, or a broken tooth, or I want you to do this, or even kind of a little bit better, I want whiter teeth, I think I want to talk about veneers, that's getting closer to values. But fixing broken teeth and dealing with primary concerns is not what I'm talking about. Is everybody on the same page with that? So we're running pretty good on time. Y'all are welcome to stop me if you need.
Do the values come from the patient, or do you instill the values?
That's a very good question. The values are the patient's values, and I'm going to do a role play with somebody in a second. I'll show you exactly how we do it. So the values are the patient's values. They have to tell you. Now, in the process of them telling you, you sort of clarify their values. It gives you a whole new context on which to talk about dentistry. You know, like if a patient came in and said, I would like a healthier mouth, and I'd like for it to be very prevention oriented, and I want a prettier smile, and if you could make me look 10 or 15 younger because facial cosmetics are important to me, those would be all 4 values that they express to you. Unfortunately, they don't say that. They basically call up and say, I want to get my teeth cleaned. Okay, where the hell do you go with that? Clean their teeth. $100 later, it's all over with. Okay, or they got a broken tooth. Well, let's put a crown on the tooth. You fix the tooth, they're gone. Okay, it goes nowhere. But I'm going to role play the whole thing with values in just a second. So basically, our sales process, the values is the core of the whole thing. We really don't sell anybody anything. And I don't like the word sell because it implies that you're giving them something that they really don't need. We just basically find out what they want through talking to their values, and we work out a treatment plan toward giving them that. Now, there's one other thing here too, is relationship is real important with the patients. The dentist has to be in the new patient room in order to develop a little bit of a relationship with the patient. Now, how much, I don't know. They just want to know that you exist, that your breath doesn't stink, and that you're a pretty nice person. Okay, other than that, you know, and you can add more icing on the cake the more you come in there. But so listen to this, dentist. If you're over here fixing broken teeth with big old fillings, and you're stuck in this room wasting your time, you're not going to be in the new patient room selling full mouth cases. Okay, and that's the dilemma. So you got to say, well, I'm willing to give this up in order to get this. Okay, so you got to give up $1 to get $100. And you got to be willing to know when you're playing this game and when you're playing that game, because we actually book doctor time in the exams and in the consults so that it's not a rushed event. And if you're rushed on their first visit, guess what they're going to think about you? You're busy. You're rushed all the time. The worst thing a patient can ever say to you is to walk in your office and say, you guys look busy today. That's about the worst thing they can say. okay? And most dentists going like, yeah, I'm great. Or if you ever talk to two dentists, one dentist walks up to the other dentist, this guy asks this guy a question. What question does he ask this one? It's the same question dentists always ask. How busy are you? Okay? That's the stupidest question on the planet. If they ask me that question, I go like, I'm not busy at all. And then they look kind of crazy. I go like, ask me how much money I made last year. Because busyness and money don't have anything to do with each other in dentistry. You can be busy. I was talking to one dentist and he says, I'm busy. He says, I'm booked up 6 weeks. I go like, you're stupid. He can't see new patients. The new patients call up, they can't see him. He's busy doing one filling at a time. So anyway, they didn't teach you a whole lot of this stuff in dental school. So here's the values questions. There's 4 values questions as I've come up with them. How healthy do you want your mouth? How prevention oriented do you want to be? How important is smile cosmetics? And how important are facial cosmetics? Okay, so I break out smile cosmetics and facial cosmetics differently because a big part of the full mouth cases that we do is done specifically for facial changes. Okay, and this is how we explain it to them. So these are our 4 questions, and what I would like to do if somebody wants to do it, we've got plenty of time, if somebody wants to come up here and grab a microphone, I'll role play this whole thing with you, with this person, and you can kind of hear how it goes in the new patient room. In our office, every operatory, our operatories are like 12 by 20. And on the long end of the room, down at the foot of the chair, we've got a couple chairs and we've got a table here. So we do all our talking right there. And so that's kind of like, we don't have a front desk in our office. Our front desk is essentially that table. We just have a front desk in every operatory. So we're sitting here talking. Now the new patient person's already kind of prepped him on what's going on and how the process works, but in either she'll do this or I'll do this. And so it sounds hopefully something like this when it works well. So Sean, we're going to go through this process in my office. I want to sit down and talk to you a little about what's important to you. And then we're going to take some records, and I'm going to look and see on the records, those are x-rays and everything else, I'm going to see if you're achieving what you're wanting. Now, if it's okay with you, I'm going to ask you a couple questions, and these are probably weird questions. Nobody's ever asked you these before. But essentially, in the world of dentistry, I either can tell you to do your mouth the way that I think it needs to be done, or we can talk about these 3 or 4 questions, and then through that conversation, then you'll sort of tell me what's important to you, and that'll be part of your treatment plan. How does that sound to you?
Sounds great.
Okay. All right, so there's basically 4 questions that I want you to think about. And so what I'm going to do is, and then I usually have this sheet of paper is already out, but you can tell I'm not quite ready. So there's 4 questions I want you to think about. And here's how I want you to do them. So and usually the way I like to do these is on a scale of 1 to 10. 1's over here, 10's over here. 1 is like, this isn't important to me. 10 is, this is very important. So here's the 4 areas. 1 is health, like how healthy would you like your mouth to be? The second one is prevention, and that's sort of like, once we get it healthy, how much do you want to keep it healthy? Or do you want to do some things to keep your mouth healthy for the rest of your life? The third question is smile, like how important is your smile to you? Is there anything about your smile you want to change? In an ideal world, how would your smile look on a scale of 1 to 10? And then the last one is sort of a weird question for dentistry, is that there's a lot of dentistry that we can do to change the appearance of your face. Like we can make precise but small changes in the height of the teeth and where your bite is and the fullness of the teeth. We can give your face more support. So in essence, we're making you look younger. So how important are facial cosmetics to you? Like if we could make you look 10 or 20 years younger, how important would that be? So then I'll hand them the piece of paper and I'll hand them the pen and I said, put a little X on there where you feel like you would like your mouth to be in each of those 4 categories. And then I'll watch them do it.
Say health, a 10, prevention, a 10, smile, 7, face, 7.
Okay, cool. So then I'll ask a couple questions. I said, so health is important to you. That's good. Now when we do your records and we come up with a plan, then we'll make sure that this is built into your plan. Prevention's pretty high. Smile, it's interesting you put a 7 or an 8 by that. Why a 7 or 8 versus a 6 or a 9 for smile, would you say?
I mean, I'd like a really nice smile, but it's probably expensive. I don't know if I can afford it.
Okay. So consider we don't know how easy it might be or what the cost might be. Even if you're concerned about the cost now, would you like to go ahead and know everything that we could possibly do for you?
Yeah, I think I'd like to know.
Okay. And same thing with the face?
Yeah.
Okay. So I'm kind of seeing you skewed a little bit toward health and prevention, which is good. And if there's anything we can do for you cosmetically, we'll sort of mention that. And ultimately, you get to decide in terms of what we're going to do. So I think I got a pretty good idea of what you're looking for. So anything you want to add to that? Or?
That sounds good.
Okay. So, and again, what we're going to do is we're going to take your records, and anything that's not real high on health and prevention, we'll say, here's a list of things we can do to get you there. And if there's some simple things with smile and face, we'll say, here's some simple things we can do to get you there. And then we'll talk about it, and we'll talk about cost and time, and we'll probably do some things to help you build trust and feel good about getting the dentistry done in the office. And then we'll come up with a plan, and then we'll get it done.
Sounds good.
Okay, good, thanks. All right, appreciate that. So that's the whole values clarification process. Now, how long does that take? 15
Thanks,
minutes. Is it time well spent? I think so. Now, so it doesn't really matter what he came in. Now, if he came in with a toothache, I would probably go, all right, let's get the toothache taken care of if you want, and then we'll come back to this values-oriented dentistry. But that's where we are on the whole values process. Any questions about that? Is this boring? Question? I like to do it because I think it's a good relationship builder. It seems to work best. I think in Sean's office, Kim probably does it more than Sean does, but it's a good process to go to. But if you don't do that, you're stuck with either. See, in essence, most dentistry is all values based. It's just the dentist is placing his values on the patient and on the treatment plan, if that makes sense. And so we're letting the patient's values drive the process. Now, if the patient came in and they said, I'm not interested in health or prevention or any of this stuff, I just want to get out of pain. Okay, so then I'm starting to think, okay, is this somebody that we need to let in the door or not? And because I'm just going like, really, that just seems to be kind of odd to me. So you don't care about losing your teeth or anything else. Your whole life is just all about fixing problems after they blow up. Yep, that's just how it is, and I'm never going to change, and that's how my parents were, and blah, 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 blah. And my big brother just got run over by a Mack truck because he didn't read the sign in the road. And I'm just thinking like, okay. So that's somebody that I would simply say, you know what, we're probably not the best dentist for you, but I know somebody that is the best dentist for you because they're set up to see you on a day's notice. Every time you have a toothache, you can blow right in there and they'll take care of it. In our office, sometimes it may take us a little bit longer to see you because we're busy, doing more comprehensive dentistry. We use a lot of forms in our office because forms provide consistency. We have a form when the patients call. There's certain information we want to give them. We did a lot of work in this past year on phone calls and making sure that the phone calls are done properly when the patient calls up. It's amazing how many patients you can lose over the telephone and not even know it. And we've recorded a lot of the phone calls. And we go back and we listen to them, and we just go like, really? You know, I've got a phone call of a person that called, that we left at the office to answer the phone, and the patient calls up, and it's really clear that this new patient is bothering the person answering the phone. Really clear, okay? And I'm just going like, you know, we have a set of forms that drives the whole new patient process and delivers all those strategic messages in the right order. You know, we have a couple of those. We have a little form we use to check off to give the patients an idea along with some photographs about what we're seeing in their mouth, and in truth, they do have some dental needs. And the patients, I mean, they don't remember diddly squat once they leave the office. So the more pictures and the more stuff you can print out, the better off you are. Make sure you print this stuff out and give it to the patients, because they're not going to remember it, and they're going to be selling it to somebody else. We use the option sheet from PrimeSpeak. This is a key slide, and Bob mentioned this. This is how we go from phase 1 to phase 2. Now let me give you the definition. Phase 1 is the orthotic reversible part, and phase 2 is the porcelain irreversible part, or ortho, whatever you want to call it. A lot of different options here. And so when a patient's in our office, and pretty much what we target with our advertising is TMD problems, okay? So we will see, and we track, we know that if we get X amount of phone calls for this service and X amount of consults, and I think our threshold is if we do 17 or 18 TMD consults in a month, we know that 3 months from now, we know how many full mouth cases we're going to do, okay? And so why do I do all of that? Because I want to know what's going to happen 3 or 4 months down the road. And if we're not getting enough calls here, I want to beef this up and speed this up so that we can consistently fix this problem 3 months from now. So you've seen my neuromuscular pipeline video. This is how we get people in the pipeline. So the patient comes in and I tell them what I'm going to do, and then they go like, well, tell me how you're going to do that. And this is how I give them enough information so that there's an informed consent going on and they know what's going to happen, but not so much information where I cause that sales balance thing to start, where they start talking about numbers and everything else, and you end up no sale, because you don't want to present too much information too early in the ball game. So I said, okay, patient, here's how this works. There's 2 phases. There's a phase 1 and there's a phase 2. And the phase 1, and we've got models, we've got orthotics, we show them all this stuff, and we go like, the first phase is to get you comfortable. If I can't get you comfortable and get everything working right, I can't get to phase 2. I said, but while we're at it, let me tell you what phase 2 might be. And there's a lot of options down here, and each one has its own different results and different costs and everything else. And if we get you comfortable in phase 1, then we'll talk about what phase 2 is going to look like. And they go like, well, what's the chances of you getting me comfortable in phase 1? I said about 99.2%. And they go like, okay. I said, so I'm just going to give you some phase 2 options so you know where we're headed. Here's basically what we can do. We're going to be sitting here about 3 or 4 months from now, and you're going to be saying, I feel pretty good. What are my options? And I'm going to say, here's the conversation we're going to have in 3 or 4 months from now. You can continue to wear this orthotic for 24/7, or you just might need to wear it at night. Now, if we've got you in a fixed orthotic and you don't want to do some of these other options, we may have to take that off and give you a removable orthotic, which doesn't happen very often. So if you continue to wear this orthotic 24/7 and it's not going to last forever, it's going to wear out, you know, there's not going to be any additional cost to that. Sometimes you can manage your problem just by wearing it at night. There's no additional cost to that. Sometimes we've made people a permanent orthotic. It looks like this, but it's just made out of metal, okay? You can't wear it out. It looks like that guy in the James Bond movie with the metal teeth. They go like, well, I don't want that. I said, well, it's an option for you. I said, you could have braces. Once we know where the bite needs to be, we can send you to the orthodontist and he can move your teeth to this bite position. Well, how long do the braces last? I said, how long will the braces take? I said, 24 months or 2 years, whichever comes first. And they go like, I don't want that. Now, if we're going to send them to the orthodontist, Tim's in the back of the room, I let him do the orthotic. And we send a bunch of people over there. I don't know how many make it. But if the patient has like really virgin teeth, or they want to be super conservative or whatever, they're not a restorative candidate. And what I want to do mostly is restorative cases. I'm not interested in learning how to do ortho. It's just too complicated for me at this point in my life. I'll be honest about it. I just want to do certain things. That's just how it works out.
You refer, I want to make sure I understood that. So Rod doesn't do any ortho?
Rod doesn't do the ortho, send it to Tim Gross.
Oh, I thought he was, oh, yeah.
Tim's in the back of the room. So send all your cases to Hilton Head. So then I'll go like, now here are the 3 options that I want you to pay attention to. Now, I don't want you to decide on them today. I just want you to understand what the possibilities are. And they've already seen the photographs of their teeth, okay? They already know their teeth are broken, or they got big fillings in them, or they got PFMs they don't like. They've already got teeth that they don't like. I said, we could just fix your bite by redoing the lower back teeth. That may be an option for you. You're not going to get the facial changes. And then they go like, well, that won't work because I want to do something with the front teeth. I said, I know, but you still got a choice. And I said, sometimes we can just do the whole lower arch. Well, that won't work because I want to do the upper teeth too. And I go like, okay, I got that. I'm just giving you some options. I said, typically what we'll do is the whole mouth. And they go like, well, I think that's probably where I'm going to end up. I said, it might be. I said, but there's several steps we have to go through yet. And then they asked the question, well, what do you think that's going to cost? I don't know what it's going to cost. Some of these bottom cases down here on the bottom, they can be anywhere from $15,000 to $60,000. It all depends on what you want to do, how many dollars you want to spend on cosmetics, and what you need. And I said, at this point, I could guess at what you need. I don't want you to decide. I just want you to know that this is coming up. But what I want you to do is concentrate on phase 1, because we're going to do phase 1 first. And then they go like, what does phase 1 cost? And I said, phase 1 is going to be about $7,000 or $8,000. Okay? Soup to nuts all the way through. If we get through with that early, you can spend some of that money on phase 2. And that's kind of how the conversation goes. I basically tell them what the next step's going to be, and I paint a picture with a broad brush of what the future holds. And then I take it all back and say, don't decide on this now, because we haven't done enough dentistry and we haven't developed the level of trust that we need to have in order for you to decide on this. Now, occasionally somebody will come in here and they'll go like, here's a check for $60,000. Okay, well that's a heavy buying sign by my definition, and I'll take the check. Okay, but I'm not going to force it to happen and lose 9 out of 10 cases at that point. But that's how I spend a lot of time on the values, and I definitely spend a lot of time on this particular page right here, and that seems to work real well for me. But if you go like phase 1, if you go like phase 1's $5,000 and phase 2's $50,000, it ain't going to happen, because they want to make a decision right then. But if you say, here's what it could be, I'm not sure we're going to get there. And we'll have tons of patients that will start with the orthotic, and mysteriously, this money shows up in the next 3 months. Okay, it's always there, it's just the trust hasn't developed yet, and that's why I go like, money is trust. They're talking money, but it's really the trust part. And both of those two things have to happen at the same time. This is a form we use when I do the neuromuscular exam. It tells me exactly what the problems are and what I have to do. We got financial forms. This is one of our sequencing sheets. So if I'm doing a full mouth case, I do the full mouth case the same way every time. And so basically we just pull out this sheet and they write appointment dates in there. We know exactly how long it's going to take, and it works out pretty good. Here's something you can do if you want to ruin your evening, okay? Take 2 pieces of paper, and on one piece of paper write full mouth on the top, and on the other piece of paper write carp. And just write down how many visits it takes to do a full mouth case, and then how many visits to do a carp case. Then write down how much extra the lab bill is, and everything else. And what you will discover is, and this is the part that's going to ruin your evening, I'm going to give you the answer so you don't have to do it, is it costs you $10,000 more to do a carp case than a full mouth case. okay, every time. In time, chair, lab costs, and everything else, extra time, it may cost you $15,000. Plus you have twice the opportunity to lose the body. So we don't do cart cases because it just doesn't work out. It's too expensive. Now, if you want to do a cart case, charge another $10,000 or $15,000. But if you got a full mouth fee and you're not charging $10,000 or $15,000 for the cart case, you're losing money on that case. That's the point. Okay, and if you write that down, you'll know it. So the most important part of the new patient process is seeing the right patients. If you're seeing the wrong patients, you can't do the right process on the wrong patients and have it work out. And that's where the whole values thing works in. So patient management is really all you need to know about practice management. There's a couple things you need to know about practice management, but if you manage your patients properly through this new patient process, I mean, you can't take a bunch of dumb patients and put them in one dental practice and have an efficient practice. You're going to have a dumb, inefficient practice. But if you have highly driven, well-valued patients in this practice kind of runs itself. And so this is where the whole thing happens. Now, here's where everybody kind of tunes out and they're going like, well, I'm really nervous about screening out patients. Try it. I mean, you can afford to lose a couple people over here in order to have more time to spend with the quality people over here. It will just be a whole lot better off. And the truth is that most patients have high dental values, and if you start discussing it with them, you'll discover it. But most patients are only as good as the previous dentist that they've been to. And so if the previous dentist that they've been to, which is probably the case, if this guy's a tooth repair artist, then the patients get trained after a while to go to the dentist and say, my tooth hurts, will you fix my tooth? Well, they're missing the big picture. They're not looking at their whole mouth, they're just looking at one tooth. You just got to get them to look at the whole mouth and you'll be way, way better off. So you're really not going to lose that many, and if you do, it's sort of like, why bother? 90% of your problems are caused by 10% of the patients. You just need to learn how to identify them. And in our office, that's worked out really well. So, you know, trading up the quality of your patients is pretty big. Getting rid of the time wasters. If you do more big cases, and that's what this, and you may not want to do more big cases. That's kind of what I like to do. If you do more big cases, you're going to get more competence. That's going to lead to more confidence, which is going to lead to more big cases. If you grow all your business systems, marketing systems, personal leadership, sales systems, if all of those grow at the same level, you know, you can move in this direction. It's pretty easy. So here's some challenges to you. So back to some of the original slides. Spend some time, look at your practice, analyze it, and be honest with yourself. Don't bullshit yourself about what you really got going on. Create some numbers, look and see what you've got, and if it's what you want, keep it. If not, then make some changes to do some things and make some changes and meet them head on. I challenge you to build the business side of your practice as well as you've done with the technical side. Otherwise, it's just not going to work out as well. Competent and confidence rules this whole game. And then, you know, develop the practice of your dreams. So if not now, then when is a good time? And I started out with this, with how my last year has been. And, you know, this is what you need to understand. Time is precious, and my vote would be don't compromise. Just flat don't compromise. Don't compromise with anything. I mean, you're only on the planet a short time, and compromising is just sort of like, for lack of a better term, just kind of a slow death. If you have any questions, call me. That's my cell phone. That's my email address. You could probably talk me out a couple of these forms that you're trying to take pictures of that probably aren't going to work out very well. I'm kind of in the process now where I may not practice quite as much, and I was talking to a couple of people earlier, and I may start another group because coaching right now kind of interests me. It gives me something to do. We got some videos that are pretty handy. Those are available to you. One last Gary Larson cartoon for you. Mr. Osborne may be excused, my brain is full.
You did great. Thank you very much, Brad.
All right. Thank you.